Welcome to the Talking Ketamine podcast, the show where we explore the science behind this fascinating molecule. This is episode 42, Ketamine, Sleep, and Oral Bacteria.
Thanks for joining us. Today we're looking at a fascinating study that connects three things you wouldn't normally put together: esketamine, surgery, and the bacteria living in your mouth.
Okay, so let's set the stage here. We need to get into the context of this study first. The main problem they're tackling is something called postoperative sleep disturbance. PSD.
Right. And this is a huge deal. I mean, when you have surgery, the procedure itself is just the beginning. The stress on your body, the anesthesia, the hospital environment, it all just wrecks your sleep.
And it's especially bad for people who are already poor sleepers to begin with, isn't it?
Exactly. The study focused on a high-risk group. They used this scale, the Pittsburgh Sleep Quality Index, or PSQI. Anyone scoring over a 5 before surgery is already in a tough spot with their sleep.
So they're vulnerable.
Extremely. And for these patients, the stress of surgery can be the tipping point.
And how common is this PSD?
The numbers are pretty staggering. It affects anywhere from 15 to a whopping 72% of patients after an operation.
Wow. And that's not just about feeling groggy, is it? There are real consequences.
Oh, absolutely. Poor sleep after surgery is linked to some really serious outcomes. We're talking about postoperative delirium, especially in older patients, more pain, even long-term cognitive problems. It slows down the entire recovery.
So finding something to prevent it before it even starts would be a massive step forward.
A critical one, and that's exactly what this study tested. They took 130 of these high-risk patients.
Okay.
And during the surgery, they gave half of them a continuous low-dose infusion of esketamine.
So what happened? Did it actually work?
It worked incredibly well. The results were really striking. On the very first day after surgery, the group that didn't get esketamine had a PSD rate of almost 65%.
Which is really high.
Very high. But in the esketamine group, it dropped all the way down to 43%. That's a huge difference, a major clinical win for those patients.
That's amazing. And I'm guessing it wasn't just their sleep charts that looked better. They probably felt better too.
They did. They reported less pain, and they also had better scores on something called the Athens Insomnia Scale. Crucially, they also needed significantly less hydromorphone.
That's a powerful opioid.
A very strong one. So they got better sleep and needed fewer heavy painkillers. It's a powerful 1-2 punch.
So, better sleep, less pain. This kind of makes sense with what we know about esketamine. But here's the twist. This is the part of the research that really makes you stop and think. They didn't just look at sleep and pain. They collected saliva samples.
Yeah.
Why? Why would you look at the microbes in someone's mouth when you're studying an IV anesthetic?
It seems like a huge leap, right? But it's because the oral microbiome is, well, it's the second most diverse microbial community in your whole body. Only the gut has more.
I think most people, when they hear microbiome, they immediately think of the gut.
They do.
Yeah.
But your mouth is this incredible interface. It's where the outside world meets your nervous system, your immune system. And an imbalance there, what scientists call dysbiosis.
Dysbiosis.
Right. That imbalance has been linked to all sorts of systemic problems, not just cavities. We're talking about neuropsychiatric conditions like Alzheimer's, anxiety, and critically for this study, sleep disorders like insomnia.
So the mouth is like a window into the body's overall stress level.
That's a perfect way to put it. It's a very sensitive barometer. The researchers figured if esketamine is working so well, maybe it's doing more than just affecting the brain. Maybe it's calming the entire system. And the proof would be in the bacteria.
So what did they find in the saliva? What actually changed?
The shift was really clear. In the esketamine group, there was a higher amount of certain types of bacteria, specifically genera like Streptococcus and Peptostreptococcus.
Okay.
These communities seemed to do better, or at least hold their ground, in the patients who got esketamine.
And what about the other side of the coin? Was anything suppressed?
Yep. They saw a lower relative abundance of a big group, a phylum, called Bacteroidota. So it wasn't a random change. Esketamine was actively reshaping the microbial community.
It's fascinating that a drug can do that. But the big question is, did it matter? Did these changes in bacteria actually correlate with who was sleeping well?
They did. The connection was robust. The analysis showed that certain bacteria, genera like Haemophilus and Neisseria, were consistently higher in patients with worse sleep and more pain.
So the more of those particular bugs you had, the rougher your recovery was.
Essentially, yes. So the hypothesis is that esketamine helps shift the balance away from that bad sleep profile, giving patients a kind of microbial protection against PSD.
That is just wild.
And it gets even more specific. They found that this whole effect, this big difference in the oral microbiota, it was especially noticeable in the older
The
patients.
ones between 50 and 65.
Exactly. The very group that's already at a higher risk for all these postoperative problems. It suggests this pathway could be a key reason esketamine is so protective for them.
Okay, this brings us to the core mystery here. How? How does a drug injected into a vein change the specific ecosystem of bacteria living in your mouth? They seem worlds apart.
It does seem disconnected, but the paper outlines a few really compelling, though still speculative, mechanisms.
Let's hear them.
The first, and maybe the biggest one, is all about anti-inflammation.
Okay.
Surgery is a massive inflammatory event for the body. It's a trauma. Your whole system is flooded with these things called pro-inflammatory cytokines. It's like your body is on fire, immunologically speaking.
And esketamine is known to be a powerful anti-inflammatory.
A very powerful one. So the idea isn't that esketamine is in your saliva killing off specific bacteria. The idea is that it calms down that systemic fire. It changes the entire host environment.
It changes the soil so different plants can grow.
Precisely. A less inflamed body is just not as hospitable to those stress-related, potentially problematic bacteria.
What about the pain relief, though? We said they needed fewer opioids. Couldn't it just be that simple? Less pain equals better sleep, and the bacteria are just an afterthought.
It's a fair question, and they did look at that. That was their second potential mechanism. And while the pain relief was definitely real and helpful, their analysis showed it only accounted for a pretty small slice of the pie.
How small?
Somewhere between about 9 and 13% of the total improvement in sleep. So it helps, but it's not the main story. Most of the benefit is coming directly from eskedamine's other actions.
Which brings us to the third mechanism. You mentioned the gut earlier.
Right. The gut-oral axis. This is the idea that your microbial communities are not isolated islands. Your mouth and your gut are in constant communication.
Through the nervous system. Inflammation.
Both. And we already have animal studies showing that ketamine and its relatives can directly change the gut microbiome in models of depression and pain.
So the drug could be influencing the gut, and that effect kind of ripples up to the mouth, stabilizing the whole system.
That's the theory. It suggests esketamine is acting on multiple levels at once, in the brain, on the immune system, and through our microbial partners to produce this one clear clinical outcome. Better sleep after trauma.
So to bring this all together for you listening, esketamine is clearly very effective at protecting high-risk patients from poor sleep after surgery. But the truly groundbreaking part here is the how. It's not just a brain drug. The evidence suggests it works by systemically modulating your body, reducing inflammation, and even shifting the balance of life in your mouth.
It forces you to completely rethink what a mechanism of action for a drug like this even is. Its benefits, whether for sleep after surgery or maybe even for treating depression, might be far more ecological than we ever thought. It's about restoring balance to the entire system, your nerves, your immune cells, and the trillions of microbes that live with you.
It's a powerful idea that the health of our mind is deeply connected to these tiny ecosystems inside of us. Thank you for walking us through this incredible new research.